Hi, my name is Satyan, and my class project is about a healthcare application called HealthBridge. In developing and underdeveloped countries, in particularly in rural areas, patients with non-complex medical issues, they need to travel long distances to get access to the healthcare facilities and doctors to get diagnosis and treatment. um, Typically whenever user experience symptoms of sickness, they call to schedule an appointment. Then they, on the appointment day, they travel to medical facility, they describe their symptoms to the doctor decides the diagnosis and provide treatment plan. Then the patient travel back home. Now many of these tasks, it can completely be avoided, or they can be simplified or automated. So for example, traveling to and back from the medical facility, it can be completely avoided, and diagnosis and treatment decision, they can be automated. Here is the block diagram of my system. On the left hand side in the blue color, user inputs their symptoms using form or uploading images and videos. Those data, symptom data, it will be used by the AI model to generate diagnosis and treatment report, which will be reviewed by the doctor, and then after that it will be released to the patient. Patient can provide comment on the treatment that they received, and also provide rating to the doctor or medical facility. And they can also connect, user can also connect to HealthBridge support staff if there is a need. um, Now, for the model transparency, HealthBridge needs to provide information on what data is being used to auto-generate the diagnosis and treatment report. It also states that auto-generated reports are reviewed by the doctors before providing it to the patients. And if AI model cannot predict diagnosis with high degree of confidence, then it will recommend video or in-person visit. The HealthBridge also provides the historical data on ratings by user and their overall satisfaction level as well. Um, uh, Uncertainty. So there is the HealthBridge. It needs to mention that it suggests patients to see a healthcare provider if symptoms do not improve within X number of days. And it will also list out any side effects for the treatment, and if user experience any of those treatments, what to do. Privacy considerations. So HealthBridge needs to comply with local data privacy and medical laws, assuming they operate in USA, Europe, and India initially. It needs to comply with HIPAA, GDPR, CCNA, and DPDP. Ethical considerations. So HealthBridge, it needs to take care of historical bias, deployment bias, and feedback loop bias. They are mentioned here. And for fairness, HealthBridge needs to have a fairness audit plan in place, and they need to regularly review the ratings and comments by users to identify individual issues versus systematic issues related to a healthcare facility. And also, it needs to regularly review training data set, test data set, and test set performance, plus monitor the performance of deployed models as well. Accountability. So HealthBridge is accountable to keep the patient data safe. It is accountable to follow local data privacy and medical laws. It is accountable and responsible to provide proper diagnosis and treatment plan and recommendations. And it also HealthBridge is also accountable to provide a way for patients to connect to HealthBridge's support staff if there is a need. For the transparency purposes, HealthBridge needs to explain how the collected data is being used by the AI model, and it also needs to provide a simplified approximation and explanation of what features are being used or what information is being used by the AI model. Thank you.